Yes, welcome to KKTV, Dr. Judi,
Thank you.
the aspiring women rep Nyamira.
Yes. Thank you so much.
Now, this is a question I wanted to ask you that you are aspiring to be a women rep Nyamira. What is the state of healthcare in Nyamira County since the advent of county governments, devolution? So Nyamira County Hospital became a level 4, which used to be Nyamira District Hospital.
Yes.
What do you understand? What is the status you can share with us about the healthcare?
So I have a lot of relatives who live in Nyamira County. My family lives there, and one thing that I'll tell you is there's lack of medications, there's lack of equipment, and a lot of people have had to be referred to Tenwek. They have been referred to like Eldoret because they can't handle the complexities over the emergencies or the conditions that the patients present with. And one thing I want to point out too is not even the leaders who actually are supposed to be at the forefront can get treatment from Nyamira District Hospital. So I have an issue with that, because you should be able to trust a system that you're investing in.
Okay.
Yes.
So, as a future women rep of Nyamira,
Yes.
what are you going to do differently to make sure that Nyamira has a good healthcare system?
Yes.
And with your background that you are a medical provider here,
Yes.
what are you going to do differently?
So what am I going to do differently? I'd say this. We've had COVID that has hit the world, and we know COVID complications, come with so many other things that we, people didn't anticipate. But one thing I'm going to do is make sure at least we have a system where everybody can be attended to on time. That, they don't have to present a card. If somebody is dying in a waiting room, Dr. Omandi, I would be so depressed to see somebody dying, just like what we saw in Wuhan, in China. I would be sad to see a relative dying because they can't get the help that they need. And yet we're investing so much in gates, we're investing so much in other systems that don't make sense.
Do you think, you have reminded me, I think I want you to listen to this clip.
This is not your ordinary gate, apparently. Its description should range from sturdy, made of high-quality material, attractive, to one that ushers in patients warmly while leaving a lasting impression to all and sundry who look at it. It has cost the county government of Nyamira an arm and a leg to undertake this construction exercise.
What do you mean that it cost Nyamira arm and a leg?
An arm and a leg. So meaning, it costs them a lot of money. It costs them an arm and a leg, a lot of money to construct a gate. But when you look at the hospital, when you look at the reports, when you look at the referrals that Nyamira, has had, it's like, what is the essence of a gate? To man patients who are coming in, or to help people who are coming in.
So do you think the gate, the value of the gate, which was put at 7 million,
that's a joke. It is a joke.
So what could have you done first if it were you?
So for me, I want to make sure that we have machines at work. Do we have employees that are competent? Do we have nurses? Do we have doctors? Do we have equipment? Do we have labs?
So you could have preferred to equip the hospital first before
the gate. Yeah. Yeah, because really, you know what is a gate gonna do for me? Is it gonna measure my heart rate? Please tell me.
That's a good question. Actually, yeah, on the same, there was...
Kuna ufununu watu wanasema imechukua 38 million, 7 million.
The county's Director of Health, Jack Magara, has come out to dispel the rumors, stating that the true cost was 7.6 million shillings, inclusive of 1 million shillings VAT.
So the total cost of the project was broken down in this manner: gate plus the sentry plus the wall plus the ablution block plus the patient waiting area in that section was to cost 2.5 million. The minor renovations in the hospital, including the external painting works, was to cost 3.5 million, and the provisional sums was 0.4 million. Total coming to 6.4 million.
But opinion is divided among residents.
Hiyo hospitali nasikia inaitwa Rivaro. Rivaro sio kuchenga geti ya milioni 7.
Geti yenyewe iko ile ya kitaifa.
So, you can see the electorate. They are, but there's one electorate who has it there clearly. Inaitwa Rivaro. But they are referring people to another place.
Exactly. So
Yeah.
what is a referral hospital when you're referring patients to another hospital? And then, you know what? You know, why would I want to sit in a cozy waiting room if I can get patient rooms where I'm able to actually take care of those patients, figure out what their state is before I transport them? You know what? That money would have been directed to maybe an ambulance. Like, you know...
Okay, listen to this.
Unawezaje kusema ya kwamba geti imetengenezwa na hospitalini wagonjwa hawana madawa?
Hii kitu kitakuja kudumu muda mrefu. Kwa sababu tena hawatarudia kuchanga wakati mwingine. Sasa itakuwa hizo pesa zingine watakuja kutumia kwa mradi mwingine. Kwa hivyo tunashukuru kwa sababu vile wametengeneza hii kiti na iko kwa standard, sio mbaya.
Tunaingia hapo ndani unaandikiwa Rivaro level 6, Rivaro Kericho. Sasa hii geti milioni 7 natusaidia nini? Mimi sina raha. Muambie serikali ya kuwa chochote wanataka kuchenga mwananchi ahusishwe mara ya kwanza. Hatuna vyoo safi, hatuna choo.
To the resident.
No.
No,
You can
oh,
the
God,
sentiment,
yes.
yeah.
You know, so, you know, what they're saying is, you know what, here, if we don't have clean toilets, we will have cholera. I mean, if we don't have, like, you know, when I go into a hospital, I want to be attended to. If we don't have any staff or, you know, anything to, like, just, you know, help my dying patient if they're in dire need of help, then you know what? A gate, what is a gate going to do for me? It's a building.
Okay.
If I, yeah, so...
Now, is there any plans now that you have lived in the US for many years and you have worked as a medical director with all these many things? What are you planning to help Nyamira's the state of healthcare if you become a woman rep?
So, as a woman rep, you know, I would love to actually sit in those meetings and I want to be able to lobby. You know, let's get that 2% that is allocated. Let's make sure.
No, we don't. What do you mean 2%?
So 2% in terms of like in the budget.
How much to where?
For women's services or you know for women reps. Yeah, so that
It's not there. It was a proposal, I think.
it was a proposal. So you know what? I'm gonna push so that it becomes a reality because this is a joke. Because here, can you imagine if a woman came in and maybe you know she was bleeding, maybe she had complications. I mean, I'd love for us to actually be able to provide the services, not a gate. You know, a gate is good, yeah. It looks good, but
a gate is good. I mean, it looks, but if it is built in a fair cost,
yeah.
But we need to give services first.
We need to give services first because, you know, yeah, we can't.
And this is a question I have to ask you. It's a personal question I have seen.
Yes.
There is one thing we forget about the healthcare system in Kenya. Like we promote hospitals from level 1 to 6. But then we can build good buildings.
Yes.
But there's one thing lacking about human capacity. I've not seen the behavior of healthcare providers have changed. They are rude. They don't take care of their patients. And you know here that the first thing of healing is healthcare. Like if a nurse is rude, maybe you have worked, if somebody reports you that a nurse is rude, or what happens here? Maybe will lose the license, will be disciplined.
Yes.
But that is not in Kenya.
That's not in Kenya. And you know, one thing that I love that you bring that up.
Yeah.
Because, you know what, people have said that, you know, they will not attend to you, especially even with pregnant women. They'll tell you, you know, they'll tell you things that are unmentionable.
Yeah.
You know, on TV. But one thing I tell you is we need to change the culture. We need to change the culture, because at the end of the day, the first part of healing is, you know what? What is my approach? When somebody is sick, I want to go in there and figure out what's going on. So, you know, I have worked with nurses, taught them, and the culture in Kenya is horrifying.
No. I do this, and it's a practical example. I had a relative of mine. I was called. He was involved in an accident, a motor vehicle accident. It was a motorcycle accident. Then I rushed. I helped the patient. I rushed to level 6 hospital in Kisi. When we arrived there is no emergency. You had to put a line. We had to wait for 2 hours. Then the doctor said, take him to the lab for X-ray. Then there was only one X-ray man who had gone to the bar. He was not there. And this person had dislocated the hip. No, I was so frustrated. I had to drive to Tenwek. Reached there at night, and I was attended, which was very well. The emergency was there. They took care, which was very nice. Now, how can we improve to change the behavior of the healthcare workers? Really, if you become a women rep, how can we change the mindset? Because totally it's a mess. That's the situation.
It's a mess. So, you know, I'm going to tell you a little bit about Judi. So I have taught in the U.S. I have worked in some of the biggest hospitals in the United States. And my hope is, you know, as a woman rep, I would bring in programs. I would, you know, even be willing to champion hospitals where we are able to get the help that we need. And we don't have to be treated mediocrely just because, you know what, we're helpless. So, I mean, I'm so sorry about what happened with your, you know, with your relative. But, you know, what I've done in the past is I have actually, you know, I've had people volunteer and they want to go volunteer. And if people can see by example, because a lot of people are wanting to go into nursing, right? Okay. We have a lot of nurses in Kenya, and I would love them to come here and see. So create an exchange program where they're able to see just how do we do things differently here, because you know, it's not right.
Yeah, but basically we have a hospital like Tenwek, which tries to exemplify. I mean, they try to treat people, they care about their patients, like warmly, like they receive you in a very different way, which can even make you get better. But in most of our hospitals, the nurses, doctors, it's like they are bosses. Right. That you need to persuade them to give you service. They think they are doing you a favor. And that is a big monster in the room. And I don't know whether you would be in a position to help that situation, but through registration, because your workers are women, mostly is to register in the assembly.
And really, my take, or you know, what I want to bring forth is you know, here. This is my experience from the United States, you know, and I've seen my relatives die in some of these hospitals. But one thing I can say is, if I can convince the legislation in Kenya to actually implement, you know, maybe monthly audits and just make sure that, you know what, our patients are not treated like, you know, they are a liability. Because that's where these nurses and doctors are getting paid from.
Yeah.
So if I can do that, then you know what? We're going places. We have 10 years.
Good. That's yeah. If you can register that, and we can.